back with Brunch, a taste of Tobago. Oh my gosh. This gentleman, you hear him laughing, right? Let me tell you why he's laughing. We were having a very, 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 very delicious discussion because he's telling me that he can cook and he wants to come on and cook. And his specialty is oil dong and iron. I can't remember what was the next thing. What was the next thing, Dr. Mac? And pilau, right? So not only is he our certified and very well able, accomplished chiropractor, he's also a master chef. So we have some trips that we have to make in order to see what Dr. Mcsween has to offer. So good morning and thank you so much. Yeah, it seems like a long time. You told me it's a month, but it seems like so long. Like I haven't seen you in so long. And I know there's some things that you wanted to bring to the forefront or you wanted to discuss. One of those things, we were talking about you did a lot of spinal
Analysis,
discussion
yes.
analysis the last time you were here. And I feel like there's so much
Yeah, there's a
to talk about. I feel
whole lot
like
to talk
we are
about
just
concerning
touching
that. Oh, yes.
just the outskirts of what those things entail.
Yeah, we were just kind of unraveling the surface.
Yeah, we were slowly
Uh,
unraveling. And then we're here today to talk about spinal anomalies.
yes.
You know, I'm just gonna let you
Do my thing.
start off
Okay.
because there's so many persons wondering what exactly are spinal anomalies.
Yes.
So let's start there.
Right. An anomaly basically is something out of the norm, something that falls away from what it's supposed to be. And so they are basic problems that the spine will carry
Mm-hmm.
and that the chiropractor must look for. And so I wanted us to focus on that and the reason for that.
Yeah.
A lot of these problems come from years and years of not knowing. Remember, we started off the program with not knowing that you don't know, right?
Yes.
And that's one of the reasons I went into the schools in Tobago. I've been to all the primary schools in Tobago,
Mm-hmm.
rendering care to the children for 1 year, and develop a scholarship program for them. And I also did it in Grenada. Why? Because of the problems I encounter as I practice.
Mm-hmm.
And it can be debilitating, it can affect your life and your health in a very serious way. So that's why I want to focus in on. And when you get these problems or have these problems and don't know that you have them,
Mm-hmm.
what you want your doctor to look at and what you want to see. Because sometimes what you don't know can hurt you, and sometimes it could certainly help in some way, but you need to know these things.
Definitely. And why is it so important? Yeah, someone comes in with a lower back pain and they can have so many underlying issues
Yes.
and threatening life issues, health issues,
Yes.
and not know it.
And not knowing it. Yes. So a person comes into me as a chiropractor. Now, any bona fide chiropractor, the first defense there is the X-ray. Must get those X-rays, and those X-rays are going to identify what the problem is in the spine. The last time we ran a reel on a guy said he's a chiropractor, and he was just moving and cracking up the people and stuff. And I said, with all those X-rays, he's going to injure the
Mm-hmm.
client. So over time, the person's going to become worse. So not knowing these anomalies, not knowing these abnormal conditions of the spine, if you go to someone and they're going to not analyze your spine through the X-rays, because that's where you're getting the information from, you're in trouble.
Yeah. And one of the things that I noticed, now the body has a way of defending itself.
Yes.
And sometimes you make things worse for yourself without knowing that you're doing that.
Absolutely.
For instance, this morning I saw a small child. She could be probably first year or second year,
Mhm.
and the bag, Dr.
Yes.
Mcsween,
Yes.
the book
They
bag,
advocate against the bags because the
it
bag,
was so
I've been
big.
doing this for years. I would say probably over 20 years. I've been saying the school bags are hurting our kids.
Yeah, it was big and it was packed.
Yes. I
It was
usually
packed.
recommend to the parent get the pull cart
Mm-hmm.
instead of the bag. You know, and if
Yeah,
they're that
keep
age
it
that
off
you're
the
speaking
back.
about, mother or
Mm-hmm.
father, take the bag with the child to school, drop the child off,
Yeah.
carry the bag upstairs for them, and in the evening do the same thing because it is putting some stress on these children that's unimaginable. I
Mm-hmm.
live close to a school in San Fernando, a Presbyterian school, and I tell you something, I see some kids with some bags on their back, they're bending forward like they're pulling a cart and that
Yes.
kind of thing. And then the child starts to complain about pains, mommy, pains.
Mm-hmm.
And the mother don't know, why are those pains? The bags bring them on.
Mm-hmm.
And that's another reason I went into the schools in Tobago.
Yeah.
I started off every Wednesday at the schools, and I saw the children for one visit every month per year for a whole year, and that was free care for them and the teachers themselves. You know,
Mm-hmm.
the bags had part of it, part in that equation for me going in there.
And the curving, because we spoke about the curvature of the
Hmm.
spine and how dangerous that is.
Yes.
When we start curving or we start leaning, is that the body's way of
Defending you.
adjusting?
Yes. Defending you.
Let's talk a bit about that,
Yeah.
because that is an underlying type of
Yes.
factor that we need to touch on.
Because sometimes you have pains in your lower back,
Mhm.
and to get away from the pain, you lean. You see sometimes in the way a person sits.
Right.
And so as a chiropractor, if I say, oh, you have a back problem, I say, oh, how you know that, doctor? True. But because they're leaning and they're leaning to get ease. So the body is doing that. It's like you're walking too. You see some people walking and they have that tilt and they're trying to get away from that discomfort.
Yeah.
Yes, and the body has a way of really responding, trust me.
Mm-hmm.
And not necessarily to help you,
Well,
but
well,
also will
clearly,
make you worse.
clearly, it's
But the
not
body,
helping
yeah, the
because
body
you're getting
responds
worse.
that way.
Yeah.
Yeah.
But what are some of the signs, or what are some of the symptoms
Yes,
that would come along with
with that.
with this type of
Yeah, well, in the lower back, you find that if you have a rotated spine and a nerve is being squeezed on one side and it's not on the other side, the person may start experiencing pain, pain in one area. If they move, the pain eases. And eventually, sometimes it goes to the other side as well. So they may get pain, they may get numbness. Grown individuals, adults may experience frequency in urination and they're not diabetic and that kind of thing. Numbness and tingling, pain in the ankles, pain in the knees, pain in the hamstrings, pain in the groin, pain in the butt, pain up the back. So these are some of the symptoms that the individual will experience. The signs of you go in the mirror, you watch yourself, you see you leaning to one side.
Yeah.
And you know, why am I leaning to this side or the other side?
Exactly.
Because of that discomfort. So the signs are sometimes very glaring, and the symptoms are sometimes very robust.
Yeah.
You know?
And like your range with regards to your range of movement. I'm assuming that this is going to be seriously affected as well. Your range of movement, your
Absolutely.
flexibility,
Yes.
etc.
So I stop a lot of patients from running and exercising when they start to see me, because if you continue like what you've been doing before, and you have the problem, and I'm fixing you, you're not helping me help you. So your range becomes kind of impinged to some measure, if I can use that term, and it stops you from doing things that you normally would have done, like bending. Say, well, you know, when I bend, I always feel this sharp pain going down my legs and that kind of thing.
Yeah.
So, and lifting, you find that if you lift objects over like 10, 15 pounds, you're in trouble. You start to feel this pain.
Yeah.
And sometimes it comes on right away without giving you notice. There are people who live with pains for years and years and not knowing the cause of it. And why is it so? Well, the x-rays give that type of information so the chiropractor can become better at what he does, particularly if he is skilled. But you cannot touch such patients without x-rays.
You know, you just said something and my mind went to another question that I wanted to ask. Now, there is the pelvic region.
Yes.
Now, I'm thinking that is attached to basically so many parts of
Yes.
the human anatomy.
Yes. Well, the pelvic region would have the sacrum that curves, and you have the pelvic bowl in there. That's where the baby comes out by the pubic symphysis and so forth. So, and there's a lot of curve inside of there. As a gynecologist, if the mother's going to give delivery, sometimes we have to measure what we call the diagonal conjugate.
Right.
That is to see that head can come through and so forth. On the other hand, you have the lordotic curve in the neck. So if I look at your spine from the front, I would not see it. So if I saw you lying on my table, I would not see the curve. But the curves I'm speaking about now is that if you go to your side, I can see the curves.
Right.
So you have the lordotic curve, you have a kyphotic curve, and then you have another lordotic curve. The lordotic curve is down in your lumbosacral region. Your kyphotic curve is in your thoracic cage, and the other lordotic curve is in your neck.
Definitely. And we're going to speak some more on these anomalies when we return, guys. Do not go anywhere. Brunch will be right back with a taste of Tobago. See you guys soon. Welcome back. Welcome back. Let me tell you something. I love you guys so much, and thank you so much for staying. Thank you for being with us, and thank you for being a part of Brunch. We are speaking with Dr. Mcsween. You know, Dr. Mac, you know, we have so many conversations. I cannot even count how many conversations you and I have had. You know, we were speaking about the wisdom of the elders. We were speaking about the innovation of the young people and how we need to harness that, and we need to really give them
that opportunity.
Yes. You know, and it ties into so much, because when you have the environment that is not very friendly, it's negative down the line. Yeah.
Make you feel you can't do this and you can't do that. Don't have confidence in yourself.
Yeah.
Don't teach you to love you. Gotta love yourself.
Exactly. And don't look for validation.
Don't look for validation.
Yeah.
I was listening to Jakes this morning, and he said, if you don't like me, I could.
Yeah. That is the way.
He said, you want to talk about me? I am good.
Yeah.
You know, that kind of thing. I think too, you must be Christ-centered, you know, and that goes a long way. But you got to learn to love Christ. You can't just come into being and love Christ.
Journey.
You got to learn it.
Yes,
it's a journey,
it's a
as you
journey.
said. And without loving Him, you're in trouble. Trust me, I know.
Yeah,
He saved me.
It's a journey, you know, and it's so wonderful that you're saying that, because, you know, as we were speaking about the anomalies, and you know, we're looking into how wonderful the human body is constructed. It, you know, it's so intricate.
Yes.
And it knows when it has to
step in
and defend you, when it knows when to tell you, hey,
something's wrong,
go and check this out. You know, it's a wonderful things. You know, I know you bought some x-rays. Let's delve in to some of the x-rays that you would have facilitated this morning. So as we delve in, you know, you can just enlighten us a bit, tell us a little bit about what's going on
and how important the x-rays are.
Yeah. You know, one thing that I wanted to ask you, while we queue up for the viewers to see. You know, scoliosis was buzzing, that word was buzzing about for some time now. You know, we just wanted to delve into that a bit. What exactly is that, and
Well,
how
yes.
detrimental is it?
Scoliosis is not a disease.
Right.
Right. Scoliosis is an abnormal curve of the spine, viewing it from A to P or P to A. Meaning I'm viewing you lying on your tummy or I'm viewing you lying on your back. Right. So you see the spine curves this way. It's bad. That is not a disease. It is an abnormal curve of the spinal column.
Right.
I think we have one X-ray there
That
yes.
speaks to that. Okay. One of the other things that has been a source of, well, I would say a small source of discussion. You know, you said that you are very, very intent on going to schools, providing that education, which is really, really, really needed. You know, we spoke on just basic things that we see those children with those enormously heavy bags.
Yeah.
You know, we spoke on that.
And they don't use all of them when they go to school.
And that is the next thing.
You know, they don't use all those
You hit the
books.
nail on the head.
Yeah,
That
it
is the
shouldn't.
next
But the
thing.
school should provide all the books for the children.
Yeah, and you know, we
know?
have the system. I mean, you
When they go to school, they log out the book, they take it to the class to finish,
Yeah.
take it back and log it back in.
or
That
have like a locker
Yes,
networking system.
have a locker in the school.
Yeah.
That each child has a locker, have a key, and they could organize themselves because that's a lot of stress on the child.
Yeah, it's really, really stressful. Although I see more parents leaning towards the pulley bags or the trolley bags, and it causes a difference. There is a difference in.
Of course, I've recommended it to
posture,
every school I've been in Tobago, and I've told you I've been to just about every primary school here.
Yeah.
And I saw an attitude and change. You know, I saw that change with the parents. They started to change the school bags and get it off the children's back.
Yeah.
So that is extra stress, huh? And you see, that's one of the reasons with the X-rays now that you may have had an injury since you're small. Since you're jumping up and down in the rugged terrain that is called our schoolyard in many areas, particularly Tobago and Grenada, and you're falling down. And nobody can tell you, well, this may be wrong. Or nobody takes you up and say, no, baby, let me take you to the doctor and see what's happening.
If you're okay.
And if you're okay, nobody does that. They may rub you and stuff. That ain't working. And then the child goes into adult and problem. One morning you get up, for instance, your husband, and he goes in the toilet and he can't get up.
Yeah, can't get up off that seat.
Or he goes to brush his teeth and he coughs. And that's it. He feel like all hell going down his legs and stuff. All injury. The majority of my patients come in to me due to old injury. And lots of times you have those old injuries and it becomes so worse that you may have to have, in the lower back in particular, a hip change.
Yes.
Or a knee change.
A knee change, yeah.
And that kind of thing. You know, a femur head change when I say the hip, right? And that comes from a long, long time. A patient comes in, I look at the X-ray, I say, man, I say, you've had this thing for years.
Yeah.
He said, doctor, you know, how you mean? How I know? I'm looking at the X-rays.
Well, you must know.
And it indicates that has to be there for some time.
Exactly.
Because what I'm looking at here doesn't happen yesterday or last year or 2 or 3 years, no, it happens a long, long, long time. And then you end up with fractures. Like we have one of the X-rays, you want to see where patient never had chiropractic care, in my estimation, but they went to people who went on their back. Person has a collapsed disc, a collapsed not disc, but vertebra. And if you don't know that, because you can't know that if you're not looking at the X-rays, you hurting the patient.
Let's delve in.
You're hurting the patient.
Yeah.
And so the X-rays are vital, and you must follow them. I say it over and over and over. You must follow those X-rays so it can guide you whilst you process what you're seeing in the X-rays.
And only then will you be able to
Help.
forge a forward with some type
Yes.
of plan
Absolutely,
as to where your
Janelle.
health lies.
Absolutely.
Yeah.
Absolutely.
Oh, my, my.
If you don't have that, you're in trouble.
Yeah.
You know?
So let's delve in to some of the X-rays. I would have indicated that Dr. Mark has provided us with some visuals of what these anomalies are, what they entail. Let's delve in. Let's look at the screen for a moment, guys. So we have.
Yes, we have an X-ray there that is a pic of the spine. Now you
Right.
can see that's the spine. The spine has a lot of attendant factors on it. We have the spinous processes, we have the lateral body, we have the mammillary bodies, we have the vertebrae themselves, you have sacrum, you have the two iliums, and you have transverse processes up in the neck and so forth.
Mhm.
So that's how the spine is supposed to look. The patient is lying on my table face down. Right, so I'm looking at the patient from the back. Likewise, both of them, that's what they indicate. So now let's look at the pics of the x-rays of the
Mhm.
real spine
Right.
that's within the individual.
Okay.
Here we go. Now,
Right.
this is, I have seen this kind of frequently in Trinidad.
Mhm.
And when I tell a patient that you've been in an accident, most times they doubt me. And they say, well, Doc, how you know I've been in an accident? No, I've never been in an accident. No. I say, you've been in an accident because this does not, what I'm looking at in your spine does not happen just so. Now, if you look at both of the hips, you look at the femur heads, you look at the femur head on the right compared to the femur head on the left, something's wrong, isn't it?
Yes.
You see there's a difference? That's an anomaly,
Mm-hmm.
right?
Doesn't
It's not
seem to be
supposed
aligned
well, no,
somehow.
no. Look at the femur head itself. There's a ball. There's a kind of ball joint that's going up into the ilium. The ilium are the two big bones, and right
Mhm.
underneath you see like a ball. You see the ball?
Yes, I see the ball.
Right. You see the ball on the right side too?
Yes.
It's clearer.
Oh yeah,
You-
definitely
Are you
clearer.
sure you're looking at the right side?
Yes, I am.
All right. You're looking at this one over there. Okay.
Yeah, I'm looking at my
Now look at the
monitor.
left side. The right is marked R. The left is not marked, so you know it's the left.
Mhm.
All right. So look at the ball on the left side. What do you see?
Well, to me, because if I'm looking, it looks slightly
Different.
Is it different in the shape? Looks a bit different.
Don't
It
you
looks a
find
little
that
bigger.
there's a capsule between the ilium and the femur head? You can see it very clearly on the right side. You cannot see it clearly
on the left.
side. But there is
Yes.
some capsule now. There is a space, but you can't see it.
Mhm.
When I magnify this, I can see a bit of a space. So I know there's probably some help for this patient. But
Right.
normally a patient comes to you with that kind of pain, and you don't know they have that. You could injure the patient.
Mhm.
You can't touch this patient without x-rays because you will not know they have a problem in the acetabulum and the femur head.
That's why it's so important to have the
Those x-rays because the patient, doctor, I've been here and there. Doctor, I went all over the place. Did they tell you what's wrong with you? No, doc. I mean,
I'm laughing. It's by no means funny, but I'm laughing because you sound just like the patient. It's like you're on one side speaking and the patient is on the
we
next.
need this education at the university level. Trust
I think
me.
so.
All right?
I think so. What do we have here?
There we have it. Now they have enlarged it. You see, there's a slight space between the ilium and that ball on the left side.
Yes, I see.
You see, there's a bigger space between the ball you see in there and the ilium.
Yes,
Right.
I see the space.
It's a marked difference.
And one of the things that really stands out, right? We're talking about anomalies, but what is so detrimental is that one person could have this going on within their body.
Yes. This is a year. It's a year's thing. Be looking at it.
Yes, that is so
Yes.
crazy.
It's years. And when you analyze and give them your what you processed and so forth, Most times they don't want to believe you, you know. There are a host of things I could identify on that X-ray that would freak the patient out.
Yeah. What else? What else do we have? Do we have more?
Yes,
that
we have a
need
few
to
more
see?
X-rays.
All
Look
right.
at. Right. So this is the scoliosis.
Right.
You see that
I
curve,
spoke
right,
about.
all the way down. Now, if you do not have, remember the guy went on either side of that young lady's back.
In
and
the
crack her
video.
up. Right. Now, look at this X-ray here. I can tell you that if you adjust this patient's right hip, you make her worse. You can cripple her.
Wow.
Because you're making the scoliosis worse.
Yes.
That's the dextroscoliosis. You have it all the way up from the neck, coming down to the lower back. The hips in this patient are okay, but after analyzing them, they have the space, the acetabulum is good, the femur is good. But here we have L1, L2, L3, L4, L5, all rotated to the right hip of the patient. Now that sometimes indicates a left short leg. Depending when you catch this problem with the patient, you can correct that as a skilled and equipped chiropractor. If you're not, you will make this patient worse. So while you adjust this patient now, and it's so clear over there, while you adjust this patient, you can actually feel the bones moving where you want them to move. And it can change this. Now, not all scoliosis can be changed. However, you have what is called compensation subluxations within the scoliosis that you would have to identify to move them. And it's only through skill.
Exactly.
It's only through skill you can do that from the X-rays, nothing else. I can do it from the MRI because I've studied the MRIs and I've magnetic resonance imaging films and I've studied the X-rays.
You know, there is so much that I love when you come to visit because the information is so much, it's so vast. You break it down to the simplest form everyone can understand, and I absolutely love that.
Thank you.
However, we are out of time.
That's okay. I'll be back.
We are out of time. So you know, as usual,
yes,
you have to be back with us. We have so much to talk about.
Sure.
So we want to thank you, Dr. Mark. Thank you so much for coming and being a part of Brunch.
You're welcome.
And thank you for the knowledge. We love that. So blessings to you from all family.
Blessings to you and the family at Tobago Updates as well.
Yes. So we're going to take a break, guys. We're going to be right back with more Brunch, a Taste of Tobago. But before we do that, this is an interesting trivia question. It speaks to which village did mud mass originate? I absolutely love this one. I kind of actually know the answer. So hip, 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 hooray on the side here. Which village did mud mass originate? We'll be back with more Brunch, a Taste of Tobago. Remember, Eye on Bago is next. You guys do not want to miss this discussion. See you soon.
You know, who would I ever believe, Jessica could take care of a child,
I know, right? I'm a kinship foster parent to my nephew Malik.
Papa, you remind me of my grandmother, you know, when she used to take care of my cousins.
If I didn't step in, I don't know where he would have ended up. Plus, I get support from Children's Authority, training, and counseling.
But Jessica, you not married?
That doesn't matter once you have a safe home and you're related to the child. You're good.
So did this give money to do this?
Yeah, they do give me some money.
So, Auntie, you can buy a Lamborghini for me?
Oh, I'm so sorry, Malik, but that money's to take care of you. Okay, smubble up, beans.
I will and try. Mommy, you can buy.
No.
Wait, I didn't even finish my sentence.
About Lamborghini, you could get lamb stew for lunch.
Auntie Jessica could only come when you come in, because all them does do is talk people business.
Malakai, I'm only going on the bed.
But mommy, the boy don't even live here.
Yeah, go to your bunkers.
What? Bunkers? Where's that?
I think I'm getting pretty good at this.
Hey, hello guys, welcome. Come have a seat. Oh, this is so stylish and I love the fabric. Darlings, you must tell us where you got your new furnishings.
We got them locally at Standard. They've got new chic European furniture, crafted from high quality material.
Oh, Standard?
No, it's Standard, their brand new Hive collection.
Experience luxurious European furniture at a price you will love. The Hive Collection. Now exclusively available at Standard.